So we're going to gather our supplies. Well, we're going to check the order, wash our hands. I think the rubric does a really good job at showing you like when you're in the med room versus when you're at the patient's bedside. So you're going to gather your supplies. So we're not only inserting an IV in this, but we're also starting our primary and secondary fluids. So your order will have you pick a specific type of secondary fluid. So you'll have to read your order. The secondary fluids will be there and you're gonna have to select the correct one based on what your order is, okay? So once you select them, you do your first check in the med room of the medications. What are our 6 rights of med administration?
Right patient, right drug, right dose, right route, right time, right reason.
Correct. You guys will do that individually for your 2 medications that you are administering. So the 2 medications you're administering is normal saline and then whatever secondary fluid you're ordered. So how that will look is you're gonna have the order sheet. Can you, actually, I thought I looked at it. So this is an example of what the order sheet will look like. So I have my right patient, John Smith. You aren't at your patient's bedside for this first check. So you're gonna look at your right patient. So I've got my right patient, John Smith. I've got my right medication. My right patient, my right medication, normal saline, normal saline. My right dose, I'm giving 1,000. This is a 1,000 ml bag. I'm giving it the correct route, IV. This is an IV bag. It's at the right time, which is now, and my reason is my patient has sepsis and needs fluid replacement. So I'm gonna do that all for normal saline, and then I'm going to do that again for whatever medication I'm giving. So my other medication. So I've got my right patient, John Smith. I've got my right medication, which is gentamicin. Is it over here? Sorry. Gentamicin, and I'm looking at my bag. This is gentamicin. My right dose, 60 milligrams. This is 60 milligrams in a 50 ml bag. That's what my order says. My right route, which is IV piggyback. This is an IV piggyback. And my right time, which is now, and right reason, my patient has sepsis, and gentamicin is used to treat sepsis infections. Okay, so that's going to take a while. Of your checkoff is going to be repeating that, but you need to do that every time. This is something that not you guys, but in previous semester, everyone messes up. They want to try to go across the board. I've got my right patient, John Smith. I've got normal saline, and I've got gentamicin. No, one at a time, all 6 rights, okay? You'll have med cards that you have to make for this skill, and I don't know if you guys looked at the bottom. They don't get submitted to Brightspace. We can look at it at the end. They don't get submitted to Brightspace. You bring them to class on the day of your checkoff, handwritten, ready to go. Not on your phone, not pictures, not on your laptop. Handwritten, ready to go, okay? We can look at it at the end. Go ahead.
Will you accept printed? So it's
You'll have to print the med card out, but handwriting.
Okay.
Handwriting. Okay. I'm gonna set these over here. Don't let me forget where they are. Okay. Everybody good with that? Understand the med checks. Okay. All right. So we've done our first med check. We have our supplies. We're gonna go in. We're gonna hand hygiene. We're gonna verify our patient. We're gonna let them know what we're doing. Hi, my name's Alexis. I'm gonna be your nurse today. Can you tell me your first and last name and your birthday? They tell me. Today we're gonna be putting in an IV. It's a little plastic piece that sits in your vein so that I can give you some medication. The 2 medications you're getting are normal saline to replace some fluid to hydrate you, and you're gonna get gentamicin, which will help fight your sepsis infection. Okay? All right, do you have any questions? Nope, he doesn't have any questions. Okay, So I'm going to open my kit here. When you guys open your kits, don't pull this paper all the way off. Leave it kind of like so that you can recover and reuse it. Your tourniquet is in there. All right.
Says to do the second medication check before you do the IV.
Yep, second
Does it
medication
matter?
check. It does matter in that sense.
Okay, so before you do the IV, do your second
Yes.
medication check. Okay.
Yep, write down. So you do your first one in the med room, second one at the bedside, and then your third check occurs right before you give the medications. Okay?
Thank you.
Yep. Thank you for reminding me. Okay, so I've got my tourniquet on. I'm palpating a vein. When you guys get your arms, you're gonna see some track marks because we reskin these once a year, but you feel the bounce, but this does not feel like a real patient. And like I was mentioning before, the premise of the skill is not to get the IV, it's that you know the steps, you know what asepsis is, you know what to do, and you know when you did or didn't get it. Does that make sense? Okay. So you're gonna feel, the way that these are set up is there's a little tube that kind of sits down in a little crevice inside here. So it does kind of feel like a bounce. If it's really hard, that's the plastic you don't want to stick there. So, all right, I'm palpating, found my vein. Take the tourniquet off. Leave it there. And then I'm gonna get the rest of my stuff set up here. Your kits come with gloves. We don't use them. You can use them if you want. This is called a Tegaderm. This will go on at the end. I'm gonna fold it right here so that it's ready for me to pull apart. This is your alcohol or your solution to cleanse with. You don't have to take it out. You can just, and in the checkoff, sorry, I'm like blocking this. In the checkoff, you can clean like this, okay? Here is your label. And they always put gauze in here in case you were to miss the IV. You can take it right back out and then you would put this here, but this is only if you miss the IV and you have to do another one like in real life. Okay? I need my IV and I need a saline. Mrs. S, I need a saline flush too. Forgot to put that in my.
3 of them.
Oh, I did?
Bucket and
I got 3 IVs. Got my IV. It's pink. Do you guys remember what size pink is?
20?
20, yes, but it will say it on the package too. It's important to know what size you're picking because it helps for documentation later. I got my 28 gauge IV. This is called a J-loop, an extension. We typically refer to it as a J-loop. This is what you will use to hook your primary tubing up to. So this part's extremely important, so pay close attention. When you open your J-loop package, do not completely pull it apart. You want to open it. Now, inside here is sterile, right? Sterile, clean. So medication is going to flow through this tubing into the patient, right? So if I start touching this, it's contaminated, which means bacteria from, even if I have gloves on, gloves sit in the rooms, they're clean, but they aren't sterile. If I start touching this, when I attach something to it, I'm telling that bacteria, hey, flow through here and into the patient. So when you open this, and through the checkoff, I'll be checking this, you do not want to touch this end with your hand, and then this end is the end that hooks to the IV itself. You don't want to be touching this either, okay? So what you're going to do is you're going to remove this cap. Now it's completely open. So you cannot touch it, okay? You're gonna keep that because you're gonna need it to practice with, but keep that. Can I touch this?
No.
No, we don't touch this either. I'm keeping my caps. So I'm going to keep it in the packaging. This is a push and a twist, okay? I'm using the packaging to touch. I'm gonna tuck it back down in there, and I'm going to flush until I start to see water come out, okay? This is flushed. I'm gonna keep this next to my patient, okay? The reason that we do that ahead of time is your hand is gonna be busy, and I'll show you here in a minute, okay? So we wanna get all of our stuff kind of set up. Does anybody have any questions about that process?
So you let water like drip out from that?
Yes. In real life, they come in different packaging typically, where it almost is kind of like a bowl and it sits in there. But yes, if you'll have a towel under your patient, it's just normal saline, so it can leak a little bit, okay? Another important thing, when you have this is not part of the skill, I'm just showing you. When you open a saline flush, there's always a little bit of air at the top. When you open, you want to try to get that air out. That's in real life. We refill them here in the lab, so they won't always have air in them, but be conscious of your air, okay? So you want to prime it by pushing some fluid out. Does that make sense? Okay. And you have to do it with your syringe pointing up. If you're like this, the bubble goes down here and then you're not getting any air out. It has to be facing up. Okay. And it's a push and a twist. You have to use a little more pressure than you think. Okay. All right, tourniquet back on again. It doesn't matter how tight your tourniquet actually is because it doesn't change the veins or anything on the mannequin. We're gonna clean, 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 clean. I'm gonna fan it dry, right? No, that was a test. Okay. All right, we're gonna leave the tourniquet on now. I'm not going to repalpate the site. I already picked it. That's per best practice in real life. You will see nurses repalpate, and just know that you will develop your own skill once you get to do this. This is like the basic, the most by the book. Does that make sense?
And in real life, you'll see nurses put on the tourniquet just once. You won't see them take it back off,
Yes.
get set up, then do it again.
Yes, usually you put it on, you're looking, okay, it stays on. You don't want it on for a long time because it's uncomfortable, but then they set up their stuff and they go. Okay. So, IVs out of the package. These IVs, see this white button right here? That is your safety. You may encounter different looking IVs. It's extremely important that before you even get near a patient with a needle that you know how it works. You don't want to be figuring it out when you're one-handed at the bedside by yourself. Okay, so this particular IV has a button that initiates the safety. And a lot of times you guys, when you go to take this off, you accidentally press the safety, which is totally fine. Nobody's hurt, but just know that that's where it is, okay? I'm gonna take this off again. I have gloves on. We're gonna look at it, make sure that it's not damaged in any sort of way, okay? See this little part that sticks up right here? This part right here, see that? Everybody seeing that? That should be on top. This little guy. That is what you're using to manipulate and thread this IV, is this little notch right here, okay? Your bevel should be up so that the pokey part touches the patient first, okay? All right, how I hold this is like this. See how this is like right here for your thumbs to go? Okay. All right. Can I touch this?
No.
No. Okay. So I picked where I'm going to go. You're going to go in at a 15 to 30 degree angle. I will not have a protractor or anything out to check this. And you want to pull the skin taut. I am right-handed, so I pull the skin taut with my thumb. Now, a real arm is going to move a lot better than this arm. It's important though that you guys don't pull taut and go like this. What am I doing?
Contaminating.
I'm contaminating, and I also might poke myself. So you pull taut, but you're pulling taut down here so that you can put it in up here. And this is just to stabilize the vein. Some of you guys might find it more comfortable to do it like this. I have always felt that using my thumb is more comfortable. Do you use your thumb, Mrs. S?
To be taught,
Yes. Okay. So we're gonna go in at a small angle, okay? We're gonna poke. What am I looking for? Blood return. Now, blood return on our mannequins, even though it looks really red in there, it's very pink. So I'm going to pull out a little bit. I thought it was also
Where you're
there.
looking for blood return is in the chamber of the IV. So
Right
it's
here.
further back.
Oh, I guess right here. It'll
Yes.
come in here
Yeah.
too. I look for it here as well. Okay. It feels like this is not what you would do. I'm just for the purposes of this so that I can show you guys the.
And we don't care if you actually get the blood return when you are checking off. We
Mm-hmm.
care about how's your technique and do you understand the skill. We
Okay.
don't care if you actually successfully do it.
It's hard in the moment if I don't get it. I tested all these yesterday. They can be finicky. So I'm going to verbalize. I see blood return. So I'm pretty sure I have the IV. So you don't want to stick the needle in all the way like this. I'm going to show you the wrong way. Okay. You don't want to do this because what that does is it could potentially puncture through the patient's vein. So we really only need the pokey part to break the skin and then we thread. So that's why it's important that that little notch. Can you see, McKinley? Sorry, I just realized you're like. So this little notch is what you're going to use to thread. You can thread with your finger like this, or, sorry guys, I changed the angle. Or, obviously you aren't gonna be doing all this touching. Or, you can, like this with your fingers, pinching right here, thread until the hub, which is the opening, is to the skin.
So there's only one part of the IV moving when she does that. It's
Mhm.
not both parts moving away from each other, just the one pink is moving into the.
So once I have it up here, I'm going to put my thumb up here. Why does my thumb go here? Anybody know? This is just so that the patient, essentially what this is like a maple syrup tap into their vein, okay? So if you aren't touching up here, this is just gonna start leaking blood. So you put this up here to try to slow the blood. I'm gonna press my button. See how it disappeared? The needle's in here, can't touch me anymore. Oh, you see my blood return coming? You can see it right there, see it? Okay, so this is gonna start leaking like this. So you wanna keep your thumb here. This is why we set this up before. I'm going to grab into my package. I don't care about grabbing the flush, I'm grabbing this part.
And you can release the tourniquet at this time too.
Okay. I'm grabbing this part. This is the part that connects to the patient. So don't grab it by the flush, grab it by this. This is what you need control of and what needs to stay sterile. Can I touch here? No. So I'm gonna pull this together, push. Now I can let go because all the blood then would flow into here. I'm going to pinch right here, being very careful not to touch the opening right here and not to contaminate, okay? All right, now I'm gonna flush. So I'm gonna pull back. When I pull back, what am I looking for? Do I have it?
Yes.
Yes. Will you pull air back in the mannequin? You will, because it's not perfectly, oh, release the tourniquet. Release the tourniquet and you will get air. On a real patient, you wouldn't see air, okay? So I'm gonna flush and you need to stabilize it when you're flushing. You can't just like pull, cause see how it'll pull right back out? Okay, I'm flushing. I don't see any signs of infiltration. I don't see any swelling, and my patient's not reporting any pain, and it's flushing easily. So now I'm going to get my transparent dressing and put it on my patient. We don't want to cover where the pink part screws in to the clear part. And that's because if we want to get access and remove this, we aren't accidentally peeling out the IV too, okay? This white part comes off. You want to label your site with date, time, and initials. Don't put this part on your patient. Rip that off. You can be done with your flush for now. In real life, you would throw this away. We will reuse it though when we do the other part of the skill. You want to tape this in a dependent position that kind of keeps it out of the way of the patient and making sure that your lock can flow free, okay? So if the doctor said just put in an IV so that we have access, you'd stop here. Does anybody have any questions? Okay. All right, but we're not done. So, get this stuff out of the way here. And your labels, you can say in the checkoff, and then I would label date, time, and initials. You don't have to actually stick this on the patient. So we're gonna keep our pieces and parts. Where does this need to go? Sharps container. Okay. Tourniquet can come off, we're done with that. Your tape you guys will probably run out of from practicing at home. Just let me know and I can replace your tape. Okay. All my other stuff is out of the way. Okay, Mr. Smith, your IV's in. Now we're gonna do your medication. So we're gonna start with our primary tubing, okay? Our primary bag and our primary tubing. So we can do our third medication check now. So this is the primary tubing. It's labeled on here as solution set. It's just a lot longer than the other one. So this Baxter tubing, I just know this from using it. It has a little perforation here. Some of you guys rip into it like a rabid raccoon trying to get chips, okay? So just, it's made to be opened easily, okay? And this also creates your little bowl in real life. Like this is where I would prime into. That's just a real life versus in here, but we can use trash cans in here. So the first time you use it, so you want to keep this bag. The first time you use it, it's going to come with this little white guy on there. We're going to take him off. This just becomes trash. You can't reuse this. Okay. So we're going to spike the bag, okay? Why are we spiking the bag and doing all of this before it's hooked up to the patient, do you guys think?
To remove the air.
Yes, this is full of air. We cannot give this to our patient. So, I'm going to keep the cap on. In real life, actually I'm gonna take it off in here. In real life, this will prime easily with the cap on. Once you guys start reusing it, it does not prime so easily. So since you guys will be reusing, we'll start with fresh supplies on the day of, you still will be reusing it. So you're going to spike and then remove the end, and then you have to be careful of the end. Okay, so when we go to spike, there's two ends. This end is like the top of a stopper to add medication to this bag if the pharmacist needed to add medication. We're gonna spike into this part. You can't get this off. This is really hard to get off. This comes off easily. So I turn my bag upside down. This is where you kind of have to figure out what works best for you, because can I take this off and start touching this? No. So I hold it, I kind of pinch it like this. I take this cap off. Can I touch that? No. So looking at both ends, being gentle and slow, you're gonna spike and it's harder than you think. So you're gonna twist until it goes, there's like a little ridge on there, okay? Another thing too, the first time you open tubing, get in the habit, you want to clamp, or else you're gonna turn this over and it's gonna start flowing and you're not gonna be ready for it. So we clamp with the roller clamp, okay? We're gonna turn it the correct way up and put it on our pole. And then we want to fill, this is the drip chamber, we want to pinch, fill it halfway, okay? Now, I'll just use, why are there no trash cans in here? Where are the trash cans at?
Oh, I had to move them because they were reusing the tables.
Oh, I'm like, I just like couldn't see any, oh, it's hiding behind my thing. Okay, cap off. Can I touch this end? No. So you want to hold this in one hand, roller clamp in the other, and you're gonna watch the fluid come down, okay? I'm gonna hold it over here so that it has somewhere to go. So see how fast that flows? That's why you wanna have your hand on the roller clamp. So we're gonna do that. Okay, roller clamp gets clamped back. You just move it up and down, okay? So I'm gonna inspect my tubing. There's no air in it. I'm making sure not to touch this to things. Great. I already did my third check. I'm gonna come over here. Should I just connect these two? Why do we alcohol swab? Yep, the patient could have, while you're setting this up, they could be watching TV moving. This just sits here. Sometimes they make alcohol caps that stay on, but not everywhere has that. So just, if you're ever unsure, it's never gonna hurt to re-alcohol. So, alcohol, 15 to 30 seconds, let it dry. Similar to the flush, we're gonna push and twist, okay? We already did our third medication check. And now we're going to test and make sure that this is infusing okay. So how to start infusing without a pump is we're gonna loosen our roller clamp. So I know that my medication is being infused because of the drip chamber. So when we get to dosage and we start talking about drops per minute, when you're hanging something by gravity, those are literally the drops you're counting. If this isn't moving, what is the patient getting? Nothing. If you can't see the drips, if that drip chamber is full, you can't see if the medication is infusing or not. I'll show you that with the secondary bag. So in your checkoff, you're gonna say my medication's infusing. Now I'm gonna start my secondary, and you can do your second or your third medication check for your secondary.
I have
Yes.
a question. So how many, like, what is the standard, like, if it's dripping by gravity, what is the standard drops per minute?
So there's standards for the tubing. Like the tubing has a drop factor on it, and we're getting into dosage, so I don't want to overwhelm you guys. You don't have to do any dosage calculation for your checkoff. I'm just, when you get to that point, I'm just showing that. So this doctor it's ordered for 125 mLs per hour. We can't count what mLs are right now because, so we would have to use math to convert that. Not making you do that for the checkoff, but in real life, we can work that out. We have a day that we practice some dosage, so we can work that out if you'd like. But don't worry about math for this checkoff, okay? So all I want to know is that you guys know I have to look at drops to make sure that my patient is actually getting the medication that I say that I'm giving them. Does that make sense? Okay. All right, what if it wasn't flowing? What would you do?
Check the IV's patency with a flush.
Yep, you can disconnect it, make sure it's flushing. I wanna look at the site, make sure the site isn't puffing up. Maybe while you're setting it up, the patient dragged it on something. You never know. So you're watching it flow here, but I'm also watching my site, asking the patient, everything feeling okay? Any pain there? Nope, okay. Also, we wanna chase our lines. Maybe this got pressed on accident. This is another clamp. So chase your lines, make sure it's not something simple and silly. This is also a clamp here. Maybe you clamped this and you forgot. So check and chase your lines first. Okay? Anybody have any questions so far? Okay. All right. Now I'm gonna do my secondary bag. So this tubing, it's much less, but it's basically the same process. You're gonna turn it upside down. We do our third check so that we know that we're safe and we're giving our patient the correct medication. This also opens easily from the top. One thing that's different is it's gonna come with this little extra piece. So you're going to lower your primary. I bet you guys didn't think you were gonna get a magic trick today. But you're gonna lower this primary, okay? And you'll see why in a minute. I took tubing out of a package. I'm going to clamp it. This secondary, there's not much room for medication to flow out. If you spike this, and your medication starts flowing, you're gonna have to start over, and it's because you have no idea how much came out, and your patient needs the full dose. So, I've got my tubing is clamped. I'm gonna use the same process, so I'm going to put this in between my fingers. I think I did it a little bit different. You'll figure it out. This is not a skill you can practice one time and know what you're doing. Where do I spike into? Red. In real life, these are typically blue. They're just red for the practice. Okay, take that off. Make sure not to contaminate, push and twist. Okay. We're gonna be doing a technique called back priming. So you can leave your cap on for this, but you wanna keep track of it. I'm gonna, this is the wrong tubing. I'm gonna have to do it down here. That's okay. You guys have the correct tubing. I think this tubing is wrong. It just has a really low.
Oh, it doesn't have the extra port.
Yeah, let me hear. Your guys' tubing is correct. So this tubing, it's an older one, but you want to use the port that's closest to the primary bag, okay? So I'm gonna use this one here just so I don't have to reprime another tubing. Can I connect these?
No.
What do I need to do first?
Alcohol.
Alcohol. Yep. So I'm gonna alcohol, and this again is where you have to work and see what works best for you. This is what works best for me. I'm alcoholing and I'm looking at this so that it stays clean, and I'm taking this cap off in a way where I can see both and I'm not contaminating. Push, twist. Okay? We're gonna hang this up. Oh no, we're not gonna hang it up. This has air in it, right? I didn't prime it with medication. I don't like to prime it with medication because you saw when I primed the primary how much medication came out, even though it was intentional. My patient needs all of this medication to fight their sepsis infection. So you don't prime with the solution. So I'm going to, with this in my hand and my hand on the roller clamp, I'm going to hold this below my primary bag, okay? And you're gonna watch, hopefully it works. Okay, it's working. You're gonna watch the primary fluid is going to flow backwards into here very slowly because of where this is. It'll be much easier for you guys. See, it's right here. The lower you hold it, the faster it goes. You guys will not have to hold it this low. And I wanna hold it down there until I'm halfway full. And again, because my port is so low, blood is backing up. This will not happen to you guys, I'm sorry.
Is the purpose of priming to get the air out of the tube?
You're getting the air out of the tube, yes, and you're priming with this solution. And the air, what's happening is the air is going up to the top of this bag. So this is what I meant by magic trick. To make it go faster, you're gonna hold it lower. To make it go slower, you're gonna hold it up, okay? That's why it's so important that you clamp it before you connect it, because the minute that you connect this, it's gonna automatically start back flowing, okay? So it's clamped. Again, blood will not rush back. This is just because this port is so low. You use the one that's closest. You guys have a port, it's like right here, okay? We're gonna hang it up. Now, another thing that we want to do, and it's in your check off and I didn't address it, is checking compatibility. So making sure, these are essentially different chemicals, right? Some chemicals don't mix well, and so when you look up a medication, you have to check compatibility. So making sure that these two are compatible. Gentamicin is mixed, the actual medication is mixed in normal saline, so I know that this normal saline and the mixed gentamicin are compatible because it's literally mixed in the solution. But in real life, there's something called Trissol's drug compatibility. You type in all your medications and it'll tell you. And if you aren't sure from there, you can also consult a pharmacist, okay? There are no tricks and treats in check off. Just remember, like, you are putting chemicals into your patient, so you need to make sure that they are compatible. Okay, so I'm going to want to infuse my antibiotic now. So to infuse my antibiotic, I'm going to open that clamp, and I want to ensure that this clamp is open as well. It's gonna run really, really fast. And then for the checkoff purposes, you're going to say, they're both running because it's not high enough. This one should be running, this one should not be running, okay? See how this filled up and now I can't see whether or not it's dripping? So to fix that, like when you're at home, you're gonna take this down, turn it upside down, pinch the drip chamber, and turn it back over, and now it's fixed. Everyone see that? Okay.
So they don't run together, only one runs at a time?
Correct. When the ports are at the right angle, they'll run separately. So the only time that when they're running together, it's because the solutions are at, and I know the solutions aren't at the same height, but like the tubing is at the same height. So when you guys, whoever sets theirs up first, you'll see what I mean when we get, whoever gets there first, we'll stop and we'll look at it. This should be dripping, this one should not be. That means that just my antibiotic is infusing and not my primary. Then when this one runs out of air, this one will start. Okay? We're not doing that in checkoff. We aren't waiting on that. What if in checkoff, what if it's not working? What do you guys think?
Check your clamps.
Yes, that's what I want to see. I want you guys to use your nursing judgment, recognize, okay, my primary or my secondary isn't infusing for some reason. I'm gonna check my clamps. The clamps, when they're unclamped, they move freely. So you'll see a lot of times in practice, I'll be going like this to make sure that they're unclamped when I want them to be. Okay, so you check all your tubing, good, I wanna see that. I don't wanna see like, it's not working, and then you look to me for answers, right? You guys need to use your nursing judgment. We talked about it, and recognize that. Another thing I'd want you to say is, or to do, is look at your IV site. I don't see any infiltration. I could also take this off and I could pull back and check for blood return to make sure if all my other stuff is correct. You don't have to actually pull that apart in checkoff. I just want to know that you guys aren't going to be like, okay, I set my stuff up, bye patient. Like, you have to look and you have to make sure your medication is infusing. If you walk away and you don't check, that's a missed dose, that's a medication error, okay? And you have to report that, okay? What else? Anybody else have any questions? We have to label tubing. How long is tubing good for? What does ATI say?
96 hours.
96 hours. Facilities are going to have different policies based on that. 96 hours. So you want to label your tubing. We're also, and it puts it in your checking expiration dates on things, checking color and clarity, making sure that nothing's expired, checking all the checks. Okay? What questions do you guys have?
So you do the medication check, so the 6 rights, in the med room, at bedside, and then right before you give the medication?
Mm-hmm.
Okay.
Yep.
And then in our checkoff, is there like a certain amount like of drips that we're supposed to have?
Nope.
No, okay. You guys aren't gonna be counting that. Just make sure it's dripping.
I need